Hello everyone, my name is Anna. I'm an MSc Audiology graduate who's brushing up all my lessons again. So today I'm going to talk about the gross anatomy of the auditory system or the human ear. Our human ear is basically placed inside the temporal portion of our skull, and the auditory system consists of the human ear and the connections from the ear to the brain and from the brain to the ear. That is the auditory system basically. So when it comes to the human ear can be majorly divided into three parts: the outer ear, the middle ear, and the inner ear. Okay, so as we move to the outer ear basically consists of the auricle or the pinna. The pinna is also known as the auricle, which is the outer portion which is visible, and the ear canal or the external auditory meatus. So let's talk about the pinna. Even though we have seen the pinna every day, this is a very cartilaginous structure. It is made up of cartilage and it is covered with a skin. It is very flexible. You can move it anteriorly, posteriorly. You can pull it outwards. It is a flexible structure. It is not just any faults or any of such things. You have each of this labeled out. So if you look at the image alongside, if you touch your ears, you can it'll be more clear. So if you see the outer portion of the ear, the outer ridge, it has a rim-like structure. This portion is called as the helix. This is called as the helix. And if you look at the diagram, you can see the portion where it comes to the end, where it merges in, that is called as the crura of helix or the cruise of helix. Okay, if you put your hand inside your helix, like if you move along the helix, you can see there is a fold inside the helix that is called as the scaphoid fossa. It is called as scaphoid fossa. And there is another structure which moves parallel with the helix. Okay, there is another structure which is similar to the helix and it is a little bit more inside and parallel to the helix, that is called as the antihelix. And the portion where it ends is the crura of antihelix. Okay, and the portion where these two, the crura of the helix and the antihelix merges, if you touch this portion, particularly this portion of your ear, there's a triangular depression that is called as the triangular fossa or the antihelical fault or antihelical fossa. Okay. If you come alongside the helix down, there is a very soft tissue or soft portion. This is called the ear lobe or the lobule. This portion is so soft because it does not have any cartilage. It is without any cartilage. Okay. And if you move above, there is a triangular portion which where the ear is attached to the face. You can see a triangular portion which is a little bit prominent. That is a tragus. Opposite to that, you can see a widening, and that is the antitragus. And there is an angle between the tragus and the antitragus. That is the incisura intertragica. Okay, and there is a bigger depression inside between the tragus and the region. There is a bigger depression in the ear that is called as the conga. So basically, the auricle or the pinna consists of the helix, antihelix, the fosses and the cruras of the helix and antihelix, the lobule, the tragus, antitragus, and the conga. So from this conga to the eardrum, we have a canal. And this is called as the ear canal or the external auditory meatus. Okay, the ear canal is continuous. The 1/3 portion of the ear canal is continuous with the auricle. So the outer 1/3 is basically made of cartilage, which is similar to that of our outer ear. And the inner 2/3 is bony. And if you see, the skin along the ear canal is much more tighter and more tighter towards the cartilaginous portion. Okay. And in this ear canal, we have if you see, your canal is not actually as straight as you see in the picture. It is more of like an S shaped. Okay, the canal is more S shaped. And if you see in infants, it is much more straighter, but not very straight. It's not like a straight line. But compared to an adult, in an infant or a child, the canal is much more bended. That's why when you do an otoscopy, how you pull the ear pinna outwards is different compared to that of an adult. So in a mature ear canal, it is more of like an S-shaped canal, okay? And within the canal, we have two different glands. One is ceruminous glands, which produce the cerumen or the wax, and the sebaceous glands, which produces the sebum or the oil. Okay, so the basic function of this wax or oil is protection and lubrication of the ear canal. It protects from the foreign debris or any other objects from going inside our ear. And we also have a little bit of hair in our canal, which again protects our ear from the invasion of the foreign objects. So I have a question for you all. So I need you all to just look up and find out what is the dimension of the ear canal. That is basically the length and the diameter of our ear canal. And I need you to comment your answers, okay? So moving on, we have a tympanic membrane. Many of our articles, I've seen a few books or few literatures referring the tympanic membrane as a part of the outer ear. And there are like another set of literatures which refer to it as a part of the middle ear. So I'm not talking about that right now. So let's just talk about the eardrum. And based on my research, majority of the literatures talk about the eardrum or the tympanic membrane as a part of the middle ear. Okay. So tympanic membrane, it is a very thin membrane. So you can imagine a rubber band or a stretched band. It is just like that. It's a rubber band stretched from both sides. So it is a very thin membrane. It is as thin as 0.074 millimeter thickness. That is the thickness of the tympanic membrane. So if you go back to this slide, give me a second. So, if you see the tympanic membrane, it's not straight from the canal. It is not situated straight. Rather, it is at an angle. It is angled at a degree of 55 degree. So towards the canal, it is in an angle of 55 degree, and it is very stretched. So it is tight. And if you see, when you look through the otoscope is an instrument which helps us to view the tympanic membrane or the ear canal, okay? And when you look through an otoscope, this is how you might be seeing the tympanic membrane. So there is a prominent portion here, which is the umbo. So the portion which is visible to us, the prominent most that protrusion which you see is the umbo. Umbo is nothing but the attachment of this malleus. Malleus is an ossicle in the middle ear, and the handle of the malleus or the manubrium of malleus is attached to the tympanic membrane. The portion where it attaches to the tympanic membrane is the umbo. So basically, whatever cone of light that you're seeing while observing using an otoscope is a reflection of the light that you're putting from the otoscope, going and hitting the umbo and reflecting back. So the cone of light is actually a reflection of the umbo. And if you see this malleus, the malleus from inside creates a falls in our tympanic membrane, which is called as the malleal fold. So even if you see here, there is a little bit of fold-like structure. So this malleal fold separates the tympanic membrane into two portions, one here above and one portion below. So if you see here, you can see here and here. So the above portion or the superior portion is called as the pars flaccida. So basically the tympanic membrane can be separated into two parts, that is the pars flaccida and the lower portion is the pars tensa. So as the name suggests, pars flaccida is much more thinner, that is very flaccid, and the lower portion is much more tense, that is like more thicker. Okay, so basically there are different layers with which the tympanic membrane is formed. That is, there are 4 layers. So if you see, the first layer will be a continuation of the skin of the ear canal, and the innermost layer is a continuation of the middle ear, mucosal layer of the middle ear. So outer layer or the first layer is a continuation of the ear canal, and the innermost layer is a continuation of the mucosal layer of the middle ear. So basically the pars flaccida, the thinner portion, has just these two layers. It just has the skin from the ear canal and the mucosal layer. But when you move to the pars densa, it has another fibrous layer, or which can be divided into two parts. So the fibrous layer has a layer of fibers which are radial. So a layer of radial fibers, and between this layer of radial fibers and the layer of the mucosal layer, we have a layer with non-radial fibers. So if you see the pars densa, it has all four layers, but when it comes to the pars flaccida, it just has the skin from the ear canal and then the mucosal layer. That's why it is much more thinner. So even when you have patients who has tympanic membrane perforation, the majority of the cases you will see a perforation in the pars flaccida portion because of the comparatively lesser thickness. So it is more prone to the perforations or any kind of traumas. Okay, that's all about the outer ear or till the tympanic membrane. And moving on to the middle ear. So when it comes to the middle ear, you can compare this middle ear to a cavity or a room which has the all six walls. So it is like a, we call the middle ear as a middle ear cavity, which consists of the ossicular chain. Ossicular chain is basically the chain of all three ossicles. Since it is suspended in the middle ear, we call it as a chain. And it has the tendons, ligaments, muscles, and also the eustachian tube. And if you see here, we have the ossicular chain as I have spoken just now. The ossicular chain consists of the three main ossicles of the human ear, the malleus, incus, and the stapes, which is attached to each other and also attached to the tympanic membrane as well as the oval window. Okay, so if you see here, basically the tympanic membrane has malleus attached to it, and the incus is attached to the malleus, and from here the stapes is attached to the incus, and here the foot plate of the stapes is attached to the oval window. So malleus is, this is malleus. Malleus basically looks like a hammer, so sometimes we refer to malleus as hammer. Malleus is the largest ossicles among the three ossicles. This is the largest. It has a head, it has a handle, and it is called as the manubrium. So basically this manubrium is attached to the tympanic membrane via umbo, the portion where it attaches, and this manubrium is attached between the fibrous and the mucosal layer of our tympanic membrane. And towards the head, so this portion is attached to the tympanic membrane, and here in the head, the incus comes and attaches to the malleus. So if you see, this is an incus. Incus at the first sight, it looks more like a tooth, and but it is more similar to a tool called as anvil. So sometimes we refer incus as anvil. So this has a short process and a longer process. So here basically the head of the incus or the short process is attached to the head of the malleus. And the long process, towards the end of the long process, we have something called as the lenticular process. This is where the stapes comes and attaches to it. Okay. So to this lenticular process, we have a stapes attached to it. So this portion, the head of the stapes or this part is the one which is attached to the incus or the lenticular process of the incus. And it has two crura, that is the anterior portion, anterior leg, that is the anterior grooves. This is the posterior grooves, and both of this comes and attaches to a foot plate or the base of the stapes. So basically the portion between the anterior grooves, the anterior grooves, the posterior grooves, and the foot plate is called, the gap between that is called as the obturator foramen. And if you see, this foot plate is attached to the oval window. Okay. So there are, apart from just this ossicle, so if you see the stapes is the smallest body, smallest bone in the human body, and also the smallest ossicles. So these ossicles have certain muscles which is helping it to move. Okay, So we have two major muscles. The one is stapedius muscle. The stapedius muscle is attached to the stapes. If you see, the red one is the stapedius muscle and it is attached to the stapes. And whenever the stapedius muscle contracts, it pulls the stapes posteriorly, pulls back the stapes. And the stapedius muscle is innervated by the facial nerve or the seventh nerve, and it is innervated basically by the stapedial portion of the facial nerve. And here in the malleus, we have another muscle, and that is tensor tympani muscle. So whenever this tensor tympani muscle is stretched or pulled or contracted, what happens is this malleus moves medially. So basically, whenever these two muscles are stretched, the stapedius muscle or the tensor tympani muscles are contracted, the entire ossicular chain is stretched or in a tensed position. Okay, this tensor tympani is innervated by our fifth cranial nerve, that is our trigeminal nerve. Okay, apart from this, there are different types of ligaments, tendons, and also we have our eustachian tube, which maintains the basic function of the eustachian tube is to maintain the pressure in both sides of the tympanic membrane, and also it drains external, like extra fluids into our nasopharyngeal cavity and all those things. Moving to the inner ear, our inner ear basically has mainly a bony portion and a membranous portion. Okay, this membranous portion is inside the bony portion. So the bony portion or the bony labyrinth consists of our cochlea, vestibule, and a semicircular canal. So these are the superior, posterior, and the lateral semicircular canals. These are right angled with each other. Then we have the vestibule. Then we have a cochlea. And inside the membranous labyrinth, this is what holds the end organ of our hearing and our balance. Okay. So these has the ducts, like the semicircular ducts, and the utricle, which is the end organ of our balance, and we have a saccule. And the duct, which cochlear duct, and the ductus reunion, which connect the duct to the saccule, and also we have our enterolymphatic sac. So we'll be talking about the cochlea as well as the vestibular organs in a separate lesson. This is just a basic overview. Here you can see the oval window as well as the round window too. Okay. So I'll just give an overview about the cochlea and I'll be winding up this lesson here. I'll be talking about cochlea as, or maybe the hearing organs as well as the balance organs in a separate lesson. So our inner ear has fluids within that, okay, which helps in the conduction of the energy. So we have two different fluids. One is perilymph and the other one is endolymph. So the perilymph is more similar to our extracellular fluids, such as the fluids in the cerebrospinal fluid or the blood serum. So it has more of sodium, similar to those, and very less potassium, whereas the endolymph has very low sodium and very high potassium. So basically there is a potential difference between these two fluids itself, which creates an energy, which creates the potentials within the cochlea, which helps us to conduct the sounds or conduct the energy. Okay, so talking about cochlea, or the cochlea portion of the inner ear, the cochlea has, or cochlea can be mainly divided into three different layers, that is scala vestibuli, scala media, and scala tympani. So basically the cochlea is divided into three portions: scala vestibuli, scala media, and scala tympani. And if you see, the scala vestibuli and the scala tympani are interconnected with each other through an opening called as helicotrema, which we'll be talking about in the later lessons. Helicotrema. Okay. So, and hence, since these two are linked, these both the scala vestibuli and the scala tympani has a similar fluid, that is, both of them has the perilymph, whereas the scala media is a separate section and it has entolymph fluid inside that. If you see, the scala vestibuli and the scala media is separated by a membranous part or the membrane called as Reisner's membrane, whereas the scala tympani and the scala media is separated via basilar membrane. And on top of this basilar membrane, we have the organ of Cottae, which holds the major sensory portion of our hearing system, which is the hair cells. It has the outer hair cells as well as the inner hair cells, and also it has the spiral ganglion, which moves on towards the cochlear nerve, which carries a cochlear nerve, the auditory nerve, which like gets combined with the vestibular portion of the auditory nerve and goes carries the information towards the brain. So this is just a very brief overview of the cochlea. We'll be talking about cochlea in detail in the coming lessons. So this is it. This is like a very gross anatomy of the human ear. I hope you all understood, and I hope the lesson was clear. Since this is just the first video, I know there will be a lot of limitations. You are free to comment your opinions and suggestions so that I can make the changes in the upcoming videos. Also, you can suggest the topics which you want, and I've posted a question. If you have the answer, comment it down below this video. And also, if you have any doubts, you can comment it down. And if you don't feel like commenting, you are always welcome to email me your doubts. If I'm able to help you out, I'll definitely be sending you back the replies. And also, you can suggest the topics as well. I hope this is helpful. I'm hoping to do more of these kind of videos. Please share it with your friends if you think that this can help them out. See you with another video. Till then, bye.